All right, I'm going to walk into my patient's room, perform hand hygiene. I'm going to identify my patient using 2 patient identifiers. I'm going to use name and date of birth. I'm going to explain my procedure and tell my patient I'm going to be performing trach care on him, and if at any point he feels uncomfortable to raise his hand or wiggle his leg. I'm going to assess his respiratory status, so I'm going to listen to his lung sounds. I'm going to check his O2 sat, and if it is below 92, I would hyperoxygenate with 100% O2. Give 3 to 5 breaths, and I have this here in case. I'm going to set up my supplies. This is not sterile, this is just to keep things clean. Okay, and now I'm going to gather my supplies. I have my trach care kit, my hand hygiene, my collar, and an extra set of gloves. So I perform hand hygiene. And the outside of this box is not sterile, but the inside is sterile. So I would open it up, being careful not to contaminate out like inside of the 1-inch border. So these are my sterile gloves. Shiny side down. I'm going to empty my contents onto my sterile field. And I would have laid that, if I didn't, I would have laid that drape away from me so that I wouldn't break sterility. Okay, now I'm going to separate my contents. I'm not going to use these. Okay, and then I'm going to check my contents inside of my bottle, check the expiration date. This hasn't been opened before, so I'm just going to pour water in all 3, pour a lot in the big one. And I did not close that all the way. So I'm going to be careful not to turn my back on my sterile field, and if I do turn my back on my sterile field, I would start over. So now at this point, I would remove the inner cannula. Place this in the big part. And now I'm not sterile anymore, so I need to apply sterile gloves. But first I'm gonna remove this lid. I'm going to observe for any drainage and look at its contents, and I would be careful not to keep this stable, not to lift it smooth. And I would discard this in a biohazard bag. I'm just gonna put that down there. Okay. Discarded these in a biohazard bag as well. So now I need to put on my sterile gloves. I'll fix this when I get my other glove on. And this hand is sterile, so I can touch this glove, just not the inside of it. And I'll be careful not to drop my hands below my waist or turn my back while I sterile field. Okay. Okay. Now I'm going to clean the inner cannula with this, clean the inside of it, clean the outside, I'm going to pour water over this, inside of it, making sure to rinse off. And I'm going to place this, making sure this is secure, lock it, and now I am just clean, I'm not sterile anymore. So, I'm going to dip this gauze in the other part of the container, wipe once away and discard. Do the same with the other ones. Dip, wipe once away and discard. And this whole time I would just make sure this is staying put and not moving around. Dip, wipe and discard. Now I want to dip these in my sterile saline and wipe. Make sure this is stable. Wipe underneath, discard. Wipe under, discard, then stabilize it again, wipe over. Discard, making sure I'm just getting any crustaceans or anything that was underneath there. Now I want to dry it, keeping everything stable, making sure it's dry underneath and on top. Okay. Now I want to replace the slit. And I'm going to, if I had an extra Q-tip, I could maneuver it up in there, but I don't. So I'm just going to try to push this underneath without moving this as much as possible, because we want to keep it stable. And this whole time I'm monitoring my patient, monitoring their oxygenation status. I have my ambu bag. Okay. Okay. I just really want to make sure that this is not pulling apart and up. And now I'm going to replace the collar. And before I remove the old collar, I want to make sure that this new one is on. I'm going to get my patient to help me pick his head up. And while I do this, I just want to make sure I keep everything stable. Again, just making sure this is not moving crazily. Okay, now I want to take off the old one. Keeping this stable. I would discard that appropriately. I'm gonna tighten this, but make sure that one finger can fit in between it. I don't want it too tight. Okay. Now I would check my patient's lung sounds again. Compare them to when I monitored them at the beginning. Okay, I would check my O2 sat. And if at any point during this it dropped below 92, I would give him oxygen. I would discard this. I would discard this and the appropriate biohazard bag. I would remove my gloves, put on clean gloves, remove my mask, then remove my gown, and I would just continue to monitor my patient since we manipulated with his trach. And after I cleaned up everything, I would clean off my table and perform hand hygiene.